You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to PM&RRecap.com to learn more.
All right. Good afternoon, evening, night, everybody, wherever everybody is. Thanks for tuning in. My name is Brandon. I'm one of the PGY3s at UC Davis, and we've got a couple of other residents. Jorge Cuza is a PGY4, one of our chief residents. Joe Hornack is one of our PGY3s, and then Quinn Howard is one of our PGY2s. They will be monitoring the chat, so if anybody puts any questions in there, they'll give their best stab at it, and hopefully you guys can get some questions answered. I'm going to fly through a PowerPoint really quickly with a lot of information, a lot of which is available on the website, but feel free to ask any questions as they come up, and then hopefully we'll have some time for Q&A at the end. So let me pull this up here. Okay. Is everybody seeing slides okay here? And a slideshow?
Yep, we got it.
Awesome. All right. So we are the UC Davis PM&R residency program located in Sacramento, California. This is us for this year. Our PGY2s at the bottom, 3s on the second row, 4s, and then our program leadership, Dr. Vandenacker and Dr. Davidson on the top row. As we mentioned before, I'm just going to fly through. We have kind of quite a breadth of faculty here. Some people that have a lot of UC Davis lifers, people that came here for residency and then stuck on as faculty. Christian has been here for almost 20 years. Dr. Dorset did his residency, left, and then came back. And Dr. Ingerson did her fellowship and then came back, among many others. So it's a great place to be, and a lot of people really like the culture here at UC Davis. Even some additional folks here and some newer folks. Dr. Mullins just finished his sports fellowship and at Stanford after finishing residency here, and then came back. Dr. Warwick finished her residency and fellowship in sports medicine here at UCD, and now is back. And Dr. Speciale also finished her sports fellowship here and stuck on as faculty. So a lot of people that really love UC Davis and are happy to stick around even after being done with training. Here's our current residents. All this is available on our website, and if you click on our names, you can get a little bit about us as well as some information about our contact information, email. So feel free to reach out. Currently, we're doing 3 residents per year with 2 categorical positions and 1 advanced position, and then as you can see, for the PGY2 class, there's 4 per year, and then that's going to gradually increase throughout the residency until we have, I think, 12 residents total, as we are working on implementing our new rehab hospital. So that'll more just come on that, so stay tuned. Here's our rotation schedule, and this is one thing that I do want to highlight because I think that we're different than a lot of programs in this way. If you look particularly at the PGY2 year, you'll notice that there's 4 months of wards plus 1 extra month of wards at Mercy. So only 5 months of inpatient compared to a lot of other programs that have more than that. And I actually found that to be quite enjoyable, giving us a chance to jump right into some of the outpatient stuff, especially as a couple of the UC Irvine residents mentioned, it's tough if you're wanting to go into something like pain medicine or pain management or sports medicine, that those have early fellowships. And so this gives you a chance to dive in and get some of that experience early, and then to see things more and on a recurrent basis as you go throughout your residency program. Then our rotation schedule, so we rotate on a 1 or 2 month block period, and then with the new 4-person class, it's on a 6-week rotation. All this stuff is available on the website, and I think we also included in the attachments for you to reference later. So I won't go into too much detail here, but quite a breadth of experience, multiple different sites that we get to work at, including the VA, the UC Davis Clinic, Shriners, and the UC Davis inpatient wards, as well as Mercy and Kaiser for a couple of rotations. Here's kind of a breakdown that's also included in the attachments about what each rotation entails, but basically you get the whole whirlwind of PM&R in a bunch of different contexts. I'm just going to go through these really quickly, but we have all kinds of different specialists and specialty clinics, including a lot of multidisciplinary clinics. Gives you the opportunity to work alongside pulmonologists, respiratory therapists, physical therapists, dietitian. So for example, in our neuromuscular disease clinic, in our Duchenne's muscular dystrophy clinic, basically every patient that comes in gets to see a bunch of different providers on the same day in an extended couple of hours appointment, and you just all alternate going in the room and can talk to each other in between each provider seeing the patient, and gives everybody an opportunity to be on the same page and really provide comprehensive care for these patients. And I thought this was a really exciting experience, and something that UC Davis has a lot of opportunities in, both in the neuromuscular clinics. The Amputee Clinic runs similarly, and then some of the clinics at Shriners also have a similar structure for the kids, which is a great experience. And you get to learn from other specialists, including like orthotists and prosthetists as well. We get to do our EMG training longitudinally, so kind of like the rest of our training, where you get introduction very early and you continue to do it excuse me, throughout your residency. So there's no shortage of experience, and you get plenty of numbers. Nobody has any issues getting to the minimum and well beyond. Cord injury clinic with Dr. Zhao, our ALS clinic, and then get to do some spasticity management, baclofen pump management, all of those things, plenty of procedural experience. The Amputee Clinic, as I mentioned, and some, usually for our didactics, we get a chance to go over to Hanger Orthotics, one of the clinics, and try out some of the prosthetics and some of the orthotics, and see what it's like to wear those, and get kind of a personal experience to help connect to our patients and help us realize what they're going through without having to actually lose a limb. Dr. Zhao does some acupuncture, both auricular acupuncture and body acupuncture, that you get a chance as a resident to get some training on, which is a nice introduction. Then we get to work with the kids at Shriners, which is always fun. And at the bottom here, this is Dr. Davidson, our program director. So obviously not shy about getting in on the fun. Pediatric spinal cord injury, kind of another one. I'm not going to dive into these, but just all kinds of different specialty clinics: spina bifida, cerebral palsy, pediatric amputee and limb deficiency clinic. Brachial plexus birth injury really gives you a great understanding of the brachial plexus and kind of management of prosthetics and, orthotics and accommodative bracing, as well as corrective and prevention of contractures. All really good stuff. A little bit of pediatric sports medicine, which is a nice kind of subspecialty if you want to even dive deeper into all of the subspecialties. And then we have our sports medicine clinic, and we have plenty of opportunities for sports coverage. The bottom right photo here is a couple years ago covering the California International Marathon, which we do every year. This is the year before that. And then we get to cover the Sac Republic soccer team. And then Dr. Faustin is one of our family medicine, sports medicine faculty, and she's actually in Japan working with the Olympic gymnastics team right now. So plenty of great minds to learn from here, and people with all kinds of connections and experience. We can also cover the UC Davis sports, football, basketball, soccer, I think sometimes soccer and gymnastics, as well as a couple of the other ones. Every once in a while an opportunity pops up. Here's some more photos from the California International Marathon. And then this year, we actually got to cover the World's Strongest Man competition, which is currently going through its airing on CBS. So you can take a peek. I think Dr. Wake, probably our current sports fellowship director, probably got some good screen time there. So a really cool experience getting to work with obviously some of the strongest people in the world, and something that may not get anywhere else. And World's Strongest Man is back in Sacramento next year, so really excited at that opportunity. We have our spine clinic, which is another interesting structure in that it's in the same, basically there's one big conference room with the orthopedic spine team, the neurosurgery spine team, an acupuncture and pain management team, as well as our PM&R non-op spine clinic. And so anytime there's any sort of patient that might be, kind of curbside the other specialists, and even get somebody over with a really quick referral. And it's a nice opportunity to learn from the other specialties. And then one unique opportunity is our post-polio clinic. Dr. V works with these patients and has people coming from all over the country, especially like even places like Alaska, Montana, just to come because she's the only post-polio specialist around. And so you get to work in that clinic multiple times throughout your residency, especially as a fourth year. And that can be a really good opportunity to work on, think about your bracing and your adaptive equipment and all of the things that PM&R has to offer. We have our inpatient rehab unit, which we're working towards a new hospital, which we'll talk about in a minute, with Dr. D and Dr. Newdorf, who are both awesome. And then here's our brand new rehab hospital, which they just broke ground on recently, anticipated to be ready to rock and roll by 2023. So for you guys applying now, that would be applicable, and it's supposed to be state of the art as a standalone rehab hospital that it will be on the UC Davis Health campus, just a little bit away from the hospital. And so this will give us some state of the art facilities and some new opportunities for our patients to work with. We get to do work at the VA, especially for a lot of our pain management and interventional procedures, which I think we're now getting more of as well, which is really exciting to get some hands-on stuff early in residency. And then we get to do an occupational medicine rotation out at Kaiser with Dr. Pavyogi, who's a recent UCD PM&R alum, and then 1 month of Mercy inpatient rehab to get a taste of what community rehab can be like on an inpatient setting. Our didactics rotates on a 12-month schedule, so you'll see everything 3 times throughout the residency. But there are a couple of lectures and other activities that don't come every year. So, every 3 years or so, you get one experience. And so not every lecture is exactly what you've seen last year. And that includes some hands-on workshops, Grand Rounds EMG conference. And we have a really good ultrasound, MSK ultrasound curriculum, as well as EMG workshops and again, you get to go through these every year, and every year you for the 2s, 3s, 4s each have like different goals for each workshop, but still starting to see some of those fundamental principles and really cement those. And these are protected time from pages, so you don't have to worry about your pager during that time. And then you do get a chance as a resident each year to give a formal lecture in addition to some EMG case conference and journal club presentations. Here's some, thoughtful photos of didactics. I don't know if this video is going to work, but we got to practice wheelchairs, or we got to, kind of move around in wheelchairs and see what the different wheelchairs were like and what wheelchair propulsion was like. And then sometimes if you're Dr. Kuza or Dr. Wilds and you just like to jam during the afternoons on rehab, go for it. Let's see here. And some more hands-on stuff, Dr. Newdorf demonstrating some osteopathic techniques, and then us working on some transfers here. Call schedule, you do 7 weeks of call, 5 weeks of call, and 3 weeks of call respectively as a PGY 2, 3, 4. It is all home call currently. And as you can see, once you're done with your PGY 3 year, you don't work any holidays. No matter what rotation you're on, you are off on weekends unless you're on call, which is really awesome to have. So basically, you don't have to worry about, oh, what rotation am I on? Am I going to be able to, be off for that weekend? Just at the beginning of the year, when you find out the call schedule, you know when you're working. And then overnights, I think the Irvine folks touched on it, and it was very similar from our standpoint. Is you're covering pages overnight. Occasionally, patient calls. You almost never have to go in. It's a rarity. Get some adaptive sports experience. There are some opportunities around here. Obviously, with COVID, that's been a little bit different, but trying to adapt to our current environment and trying to figure out ways to still get involved with that. Plenty of research opportunities in whatever areas you're interested in, and many of our residents present at national conferences. We have a fellowship in sports medicine. Currently, we have 2 sports fellows this year, and then our pediatric rehab fellowship. Our current fellow is in his 2nd year, and then we have the neuromuscular fellow, which is actually the only neuromuscular fellowship within a PM&R department. And I'm going to fly through why Sacramento. There's a lot of great things. Good food. We're actually the farm to fork capital of the United States. There's a couple of sporting or sports teams, the Sacramento River Cats, the Republic, and there's articles on why Sacramento is awesome. California has a ton of close things. Sacramento's right here in the middle. San Francisco is an hour and a half to the west. Lake Tahoe is an hour and a half to the east. You have Napa over here, you have Yosemite and the Sequoias down here, you have the Pacific Coast Highway and Big Sur, 3 hours, all the stuff is right within reach. You can snowshoe, you can, I know I have friends that would snowboard in the morning, come to Sacramento and skateboard in the afternoon and surf at sunset. So you can kind of get all 3 things in with all the proximity. Some stuff in Yosemite, backpacking in the Eastern Sierras. You can go to San Francisco, you can take some hikes, all kinds of fun stuff. Now I want to leave time for questions, but we do like to have fun. Some of our residents doing things pre-COVID, going out to the clubs and having a few drinks and a great time, rafting the American River. And there is a resident retreat every year that we do up in Tahoe. And we actually were able to do it kind of in between when everything opened really quickly. We got a retreat in and then everything is kind of backpedaling a little bit now, but we're excited to be able to do that again this year. So hopefully in the future, it's a great time. A couple of the attendings usually come and say they get after it as much as we do, which is awesome. Zumba, holiday party, fun things, hiking, and us having a good time. So I think you'll find that we have a really great culture and a lot of opportunities for pretty much anybody that wants to be here. So I do want to leave time for questions, but I appreciate all of your attention. So with that, anybody's got any questions, go ahead and fire away and I'll give the other guys a chance to answer as well. How would you describe the culture at UC Davis in one word? Dr. Kuzo or any of the other ones you guys want to shoot one answer here?
I'd say family, a very close-knit group, and that was something that drew me to the program initially. As you can tell, not too many residents, but we have tons of attendings that we work with, so lots of one-on-one time, and they are really laid back and approachable. So I think we pick residents historically based off that, just kind of down to earth and approachable and easy to hang out with and work with. And I think that applies to the attendings as well.
Awesome. Yeah, I totally agree with Jorge on that. And I think that kind of goes along to one other question about what are you most proud about your program. I think the same thing, at least for me, the culture, absolutely. Let's see. How prepared do you feel to answer the fellowship interview question? Where do you see yourself in 10 years? I think everybody's got their own different answer for that, but I think that the breadth and structure of UC Davis PM&R training absolutely prepares us well. You get to see things multiple times, and the first time you're just getting your feet wet, it feels overwhelming. The next time you come through, you've already seen it, you've gotten comfortable, you've learned things from that rotation and other rotations to get that you can really apply. So absolutely, I really appreciate the structure.
And just there's a question about mentorship. I think that really what I was saying about how we get a lot of one-on-one time with attendings, and there's an open door policy with everyone, and we do have mentorships established, and you have a faculty established for your, I guess, assigned mentor. But really, I mean, I've been asking each and every one of my attendings that I work with for advice, especially now that I'm looking for jobs. So I've gotten lots of good advice and also lots of good contacts and connections. So I think we have a pretty strong and solid mentorship program.
Right, about 2 minutes left.
Cool, thanks, George. We've got a question saying, do you think there are specific things for your program looks for when interviewing candidates? I think because of our culture, we are like a family here, and you work really closely with everybody, both residents and attendings. And so we're looking for people that we want to work alongside with. That's really what it is. Someone that's a good team player, that, you know, works hard and gets their stuff done, and that's reliable, but that also you're going to have a good time with in the team room. I think that's, and even afterwards. So I think that's at least what I think the rest of the faculty and the rest of the residents look for. Do you feel that your program is stronger in either inpatient or outpatient, relatively equal? I think you get plenty of experience in each. I don't think there's any real shortcomings. I mean, plenty of our Jorge is planning on doing inpatient practice, as is actually the rest of our PGY4s are all planning on doing kind of general practice in inpatient. But then if you were to look at the class before then, we had, I think, 2 people go to sports fellowship and 1 go to pain. So you can get plenty of opportunities for everything here. So we got some answers there. Let's see, did I miss any questions? In terms of research, all the faculty are super approachable. So if anybody's got any projects going on, or if you wanted to start a new project and are looking for a mentor, everybody's really open to that. And in terms of conference presentation, we actually, one thing I didn't mention yet is that UC Davis just has a new resident union and ratified our first contract, and so got increased educational funds as well as a housing stipend and other things for the residents. And so that gives us more opportunities to participate in research and go travel to a conference. And then we do have research days allotted every year, I think 4 research days that you can use for conference presentation or whatever else. And I think we're probably about out of time, but if anybody has any other questions to add to the chat, go for it, and we can try to answer those in the chat while the next group is going. But I appreciate everybody tuning in. Again, I think George has the information for our program director or program coordinator. Then also you can follow us on Twitter and Instagram. And then, like I said, on our website here, basically if you search UCD PM&R Residency, you can click on our names as residents, and pretty much anybody will be happy to have an email from you and answer any questions that you may have. So thank you all for tuning in, much appreciated.